Wellness Wednesday, sponsored by Baptist Health.
Welcome back. June means summer is here, but it's also Men's Health Month. And this morning we are talking about why men need to make their health a priority. Health officials say men on average die nearly 5 years earlier than women. And one major reason is that men are less likely to go to the doctor for regular checkups. Well, joining us this morning to tell us about the screenings men should be getting is Dr. Matthew Savage with Baptist Health Sherwood Family Medical Center. Dr. Savage, thank you so much for being here.
So happy to do it.
So the first question I have for you, why are we as men so reluctant to book that appointment?
I think a lot of it comes down to time. We're busy. We're taking care of our jobs, our families. It's just not something we've been taught to prioritize. We don't think about ourselves. We're often thinking about others.
What can you say to the man watching right now who probably hasn't been to the doctor in 5 or 6 years?
I'd say it's time to come in. It can be as short as 30 minutes, an hour at most of the time. Draw some blood work, check your heart, lungs, just get a good checkup.
Well, Doc, some of the biggest threats to men are really silent. What are 2 or 3 invisible conditions men should be screened for that don't show early symptoms?
I'd say the 2 biggest things that I diagnose the most often are hypertension, high blood pressure, and then high cholesterol. They can be silent. Some people with high blood pressure don't have any symptoms, but both of those things can be very dangerous if left untreated.
We know health needs change as we get older. Could you give us a quick roadmap of the critical health milestones for men in their 20s, 30s versus 40s, 50s, and 60s?
I'd say the 20s and 30s are really times that you need to be setting yourself up for success in the future, getting good exercise, diet, focusing more on weight, preventing those long-term conditions. And then as you age in those 40s, 50s, 60s, we start screening for things like colon cancer, prostate cancer, lung cancer if you're smoking. So that's kind of where we're at.
Well, what is the best way for loved ones to encourage a man to see a doctor without nagging him or making him feel defensive?
It can be really hard to do that, but what you need to do is convey that message of caring. I care about you. I want you to be safe and well taken care of. You need to prioritize yourself. So if you come at it from that angle, sometimes they're a little more willing to go.
Well, doctor, what would you say to the men who sort of feel a little sense of, either fear or whatever this nagging little pain is, I can overcome this because I'm a man?
I think there is a lot of that in our culture, but what you need to do is say, I may not be able to do this alone, and there's a physician out there that's going to be willing to help me. Go see him. Take that 30 minutes to an hour. It may be one day, you may need to go every few months, but you need to prioritize your health.
And my last question, Doc, if you could encourage men to make one change in their health starting today, what would that be?
Get outside 30 minutes a day. Sunlight is so good for you. It'll encourage you to exercise, increase your energy. It just has so many benefits. Get outside.
Dr. Savage, thank you so much for your time.
Thanks for having me.
Well, if you would like to get in contact with Dr. Savage, you can do so by going to Baptist or just head over to their website or give them a call. That information is right there on the screen.